Welcome to Bloodborne Pathogens Training for School Personnel. Bloodborne Pathogens Standard requires that employers reduce or remove hazards from the workplace that may place employees in contact with infectious materials. This applies to employees who may be exposed to blood or other body substances. All personnel should receive information on the dangers of exposure. The standard also requires an exposure control plan for the workplace. Sorry, but it's the law. The learning objectives for this training are what serious diseases are associated with bloodborne pathogens, information on these diseases and how they are spread, how to control bloodborne pathogens in the school setting, how to recognize situations of potential exposure to bloodborne pathogens, and what to do in case of an exposure. Bloodborne pathogens can be present in blood, spinal fluid, fluid surrounding joints, amniotic fluid, breast milk, vaginal secretions, and semen. They can spread diseases causing serious illness or death. Exposure to feces, urine, tears, saliva, vomit, sputum, and sweat are not considered exposures unless they contain visible blood. They may, however, cause other gastric illnesses or infection. Bloodborne pathogens enter your body through open cuts, cracks, nicks in the skin, skin abrasions, dermatitis, acne, and mucous membranes of the eyes, nose, and mouth. School incidents that may lead to bloodborne pathogen exposure include student or staff injury, multiple injuries, nosebleeds, human bites, and inadequate cleaning. These incidents often occur on the playground, on playground equipment, in the gym, classrooms, and hallways. The bloodborne pathogens of concern are hepatitis B virus, hepatitis C virus, and the human immunodeficiency virus. Hepatitis B virus is a serious infection of the liver and can lead to cirrhosis, liver cancer, and death. 30% of people have no early symptoms. The virus can survive in dried blood for up to 7 days. Hepatitis C virus is the most common bloodborne pathogen infection in the United States. It may cause liver damage, cirrhosis, and liver cancer, and is the leading reason for liver transplants. 85% of people with hepatitis C virus are unaware. It may occur after exposure within 2 weeks to many years later. Early symptoms of hepatitis B virus and hepatitis C virus are fatigue, loss of appetite, nausea, vomiting, jaundice, fever, abdominal pain, joint pain, dark-colored urine, and gray-colored stools. Hepatitis B virus can be prevented by vaccination. The vaccine is provided at no cost for identified personnel by the school district. 3 shots are required for full immunity. There is currently no vaccine for the hepatitis C virus. New medications are becoming available, however, they are costly and not always covered by health insurance. HIV damages the immune system, interfering with the body's ability to fight the organism that causes infections and disease. Currently, there is no vaccine or cure. HIV leads to AIDS and death. The symptoms of HIV include mild flu-like symptoms, unexplained weight loss, diarrhea, fatigue, and persistent fevers. Symptoms often do not appear for many years. Current treatment includes a combination of antiviral medications. There is currently no vaccine or cure. An exposure control plan is required by OSHA. It outlines the protective measures an employer will take to eliminate or minimize incidents of employee exposure and includes information on training, specific precautions, at-risk employees, and procedures to follow in the event of an exposure. A copy can be found in your school. Standard precautions advise that all blood and body fluids are considered potentially infectious, as there is no way to tell who is infected by appearance, and many carriers have no knowledge or symptoms of their disease. Standard precautions for reducing the risk of exposure include hand care, appropriate personal protective equipment, engineering and work practice controls, housekeeping, and the Hepatitis B vaccination. Wash hands with soap and water frequently and immediately after an exposure to blood or body fluids and after removing gloves. Avoid chapped or cracked hands by using a water-based lotion. Always wear gloves anytime there is contact with blood or other body fluids. Wear a mask and eye protection if there is any chance of splashing. Wear a gown if there is a risk of splattering or spilling. Your school nurse has access to all protective equipment. These work practice controls reduce employee risk of exposure using sharp containers, red biohazard bags, the disposal of biohazard waste, and staff compliance with the exposure control plan. Always notify your school custodian to complete cleanup and decontamination with an improved disinfectant. Do not attempt to clean up without the appropriate equipment and cleaning products. For any potential exposure, wash hands, remove contaminated clothing, and for any contact with mouth, nose, or eyes, rinse or flush with water for 15 minutes. Report the incident to your supervisor or school nurse as soon as possible. Complete the online Incident Injury 911 form, the Exposure Incident form, and the Workman's Compensation form. Secure medical care within 4 hours or as soon as possible. Thank you for your attention. Please address any questions to your school nurse.